As the state's nurses and midwives fight the Min's government for a new pay rise, some new independent data has highlighted their increasing workloads. The figures reveal that emergency departments are facing some unprecedented pressure. The Health Minister pointing out that many patients simply shouldn't be there.
Historic action at Prince of Wales Private Hospital. Nurses and midwives walking out for the first time, joining public sector colleagues in demanding a 15% pay rise. In the public system, new data highlights the strain they're under. In the July to September quarter, 787,000 people visited an emergency department, nearly 16,000 more than the same period last year. But once there, only 61%, two-thirds of patients, had their treatment start on time. The worst result since the Bureau of Health Information started reporting in 2010. Bolstering a union claim, nurses are overworked and underpaid.
They're relying on our members to deal with this increasing volume coming through, and yet they're still not recognising them in a decent pay offer.
While more than half of patients spent less than 4 hours waiting in the ED, 1 in 10 waited longer than 11 hours. More than 67,000 people appearing to give up and leave.
Patients are worse off under Chris Minns than they were 20 months ago.
But many shouldn't be there. A survey of 21,000 ED patients revealing more than a quarter thought they could have been treated by a GP. But 38% didn't go because the clinic was closed, and 23% said they couldn't get a GP appointment.
I don't think any of us can agree with the situation, where 1 in 4 people sitting in our EDs right now really should be at a GP, but they can't access one.
A question of funding that seems to be increasingly common. Lachlan Kennedy for 10 News First.